At the lingual side of the mandible, we place the meniscus very rarely because the lingual cortex of mandible becomes thinner from anterior to posterior. The posterior lingual cortex is very thin. The screw placed on lingual posterior part of mandible is very unstable and it is very irritating to the tongue. So it is not a good idea. But if you have to or insist on placing a screw at the lingual posterior area of mandible, you'd better do so-called bicortical insertion. With a screw 12 mm or 16 mm length, start from the lingual side and engage the buccal cortex, penetrating the bone between the roots. But it is too complicated to place a screw. So the posterior lingual cortex of mandible is not good place to place a screw. At the anterior part, the bone is thicker than posterior, but the space between the teeth is very narrow, so it is difficult to place a screw. And also it can cause irritation to the tongue. So rather than lingual, you'd better find labial application. But there are some exceptions. Many patients have big torus. If there is a torus, it provides good position to place meniscus. As there is no important anatomic structure and the bone is dense, so you can place a screw in vertical pattern while trying to minimize the irritation to the tongue. To place a screw at the torus, you should use motor-driven handpiece or e-drive, for example, and a shaft with medium size in length. With a manual driver, it is difficult to orient the path properly. Patient cannot open the mouth that much. 1.6 mm and 6 mm screw will do,